Recording in progress. Hello, everybody, and welcome back to School of Speech, presented by SpeechTherapyPD. School of Speech is the podcast for all of us school-based SLPs to come together to learn boldly, think critically, and shine the light on all the incredible work that we are doing in schools every single day. I'm your host, Carolyn Dolby, and I am so glad y'all are here. Today's episode is one I am especially excited about because we are diving into a topic that is really gaining more visibility, but it still carries a lot of confusion in school-based practice: developmental language disorder, or DLD. Joining me today are two incredible guests from Idaho. We have Wendy Morgan and Diane Ogiela. Yes. Wendy is an associate clinical professor and clinical coordinator with over 15 years of experience focusing on preschool and school-age populations. Diane is an associate professor and director of the Child Language Lab and current graduate program director with deep expertise in language development disorders and assessment practices. Wendy and Diane, welcome to the podcast.
Thank you for having us.
Thank you.
Oh, we're
Happy
so
to be
pleased.
here.
Oh gosh, I'm so excited for today. Before we get started, just a few little housekeeping. Y'all don't forget that every single episode of School of Speech is offered for 0.1 ASHA CEUs through your Speech Therapy PD account. And if your state license requires live CEUs and you are hanging out with us live today, well, thank you for being with us. But I also want to make sure that you get credit. So be sure to complete all the modules, including the one that says complete course, before the end of today on your Speech Therapy PD account. Also, we love and truly encourage your questions and comments. So if you are listening live, I want to make sure that you use the chat for any of your questions and comments. And I want to get the chat going. So all you listening live, jump into the chat, say hi, and let us know where you're tuning in from. And while you are jumping in saying hi, live audience, I am going to go over our disclosures. I am a salaried employee of Portland Public Schools in Portland, Oregon. And I do receive compensation from Speech Therapy PD for hosting School of Speech. Wendy receives a salary through her role as an employee of Idaho State University. In addition to her financial relationship, she is actively involved in professional service, including membership in the Idaho Speech, Language, and Hearing Association and ASHA, and she serves as a clinic coordinator. Diane receives salary from Idaho State University as well, and occasionally earns honoraria from delivering lectures and workshops. She's also an active member of both Idaho Speech, Language, and Hearing Association and ASHA, and she serves as the SLP program director, and she does not have any additional relevant financial relationships to disclose that are related to this episode. All right, let's get going. Oh, look, hi, everybody. Oh, I love seeing where everybody's from and saying hello. And I love the fact that I am now really starting to see a lot of familiar names that I've seen from past. So thank you all welcome to our new listeners, but welcome back to all of those that I have seen before. I love it. This really makes my heart sing. Love it, love it, love it. All right, let's get into why we're here, right? So I want to start with like a really foundational question, because basically I know that we've got a ton of listeners today, and I know that we're all asking the question, is DLD a different type of language disorder? And how is it different from a language delay, or what we would typically call speech language impairment? All these little terms. Set us straight, ladies, set us straight.
Okay. Well, DLD is a thing. Let's just start with that. It is a thing. And one of the issues is that we haven't thought about it as a thing. In the schools, we've often talked about, just use this kind of broad terms like language delay, language impairment, language learning disability. We have all these different terms, and we don't have a unified idea of what that is. And therefore, we don't have a unified idea of what we tell parents their children have difficulties with. And it makes it difficult for them to access information, resources, community, of people who share similar challenges. So developmental language disorder is a term that is relatively new and about, I think it's 2016, 2017, the Catalyst group came together. It was an international group that came together of clinicians, researchers, et cetera, to really unify the terminology. This is really important because we have to have something that we're talking about and know that we're talking about the same thing. Now, how it's really different than a delay is that when we say delay to parents, it makes it sound like it's going to go away, like you're going to catch up. And so it doesn't feel like it's really that important or urgent to address it. So if a child is still struggling with language problems that aren't caused by something else, by the time they're in kindergarten, we have to stop talking about a delay. At that point, we really need to be acknowledging that it's a disorder, that it's a long-term, if not lifelong, issue.
Did you say kindergarten? I'm so sorry. I didn't mean to cut you off.
I said kindergarten, and it kind of depends on how people categorize things. Late preschool, kindergarten, but really by school age, by the time the child is in school, if they're still having difficulties, they're not going to go away by themselves. They're very highly unlikely to go away by themselves, even if they are less obvious, because one of the challenges with language disorder, with DLD, is that it's not always that obvious that it's there, but it becomes obvious when they have to use language and understand language. Now, the way it's different from speech language impaired, and I'll talk about this kind of a little bit later, maybe some more, is that speech and or language impaired is not a diagnosis. It's not a thing. It's a bucket. And it's a bucket that articulation disorder can go into, fluency disorder can go into, DLD can go into, social communication disorder can go into. It's just a bucket of speech and or language impairments. And so that's an important distinction to make. So DLD isn't new. It's what all of us had previously called language impaired, receptive expressive language impairment. We've all had these kind of different terms for it. So as we come together to have this unified idea of what it involves, it does have lots of facets. But it's a primary language impairment. So it's when there's a language impairment that's not accounted for by some other cause. It's not due to autism, it's not due to an intellectual disability, it's not due to hearing loss or cerebral palsy or any of a number of other potential causes. So it's a primary language impairment. It is the main problem. Now, it can be accompanied by other things, but it's not due to other things. And so kids with DLD are going to have difficulties across the domains of language. It could be word learning, morphology, those little bits of language, putting words together into sentences, into complex sentences, so morphosyntax, grammar, difficulty putting language together in discourse, in a narrative, or to give an explanation of something, or to comprehend the instructions on the science experiment, or the Oregon Trail project. Our kids all do Oregon Trail in fourth grade, so that's always in my mind. And some children will also have phonological issues that go beyond just the pronunciation of words, that also have an impact, like phonological processing, phonological memory issues that can also play a role in DLD. Kids aren't going to look the same, but they are going to have similar patterns. So some kids will have greater difficulties in semantics. Many children will have greater difficulties in morphology and syntax. And that's where some SLPs are less comfortable in that realm of morphology and syntax, especially complex syntax, because we don't always have that background to address those challenges. In the area of pragmatics, we have to be really careful, because the pragmatic difficulties that children with DLD have are typically the result of these other language issues and not the cause of the language issues. So the pragmatic difficulties of children with DLD tend to be very different than those of children who have social communication disorder or autism.
I'm
So
glad you said that because when you were saying that DLD is when everything else has been ruled out and it's not ruled out, but basically it is the main culprit of the language impairment, not due to like autism. And so my thought was, well, wait a minute, but then autism has a language component to it. So sorry, I want to hear more about that because I like the way you're making it. Tell me more, use more words about breaking down the pragmatic area between DLD and ASD, because I think that's going to be a light bulb for me.
great
Thank you.
question.
Yeah.
So in autism, pragmatic difficulties are often part of that driving force, the social pragmatic issue. That doesn't mean that they don't have difficulties with semantics, morphology, and syntax, but it's more of a driving force. And in autism, it's a spectrum. So we have children who have impeccable grammar and still have autism. And we also have kids who are nonverbal and have autism. So there's a wide range with pragmatics and autism, as well as the other domains. For a child with DLD, let's take, for example, politeness. Okay, politeness is often taken care of through indirect language. Indirect language tends to be more complex. So a child who has DLD, let's say a young child with DLD, might say, "Gimme cookie" for a longer period of time than a typical child would. The typical child at 5 or 6 might be saying, "May I please have a cookie?" But "may I please have a cookie" means the same thing as "give me a cookie," frankly, right? But it's indirect and it's more complex. And even more indirect is, that cookie sure looks good, right? Well, the child with language impairment is going to be more literal because they're going to have difficulties with language overall. So that's a type of an example. Another example is that a child with DLD is more likely to have difficulty with higher level vocabulary, topic specific vocabulary, complex sentences. And so if they're talking with their lab partners about a science experiment, they might have a communication breakdown because they don't have easy access to the vocabulary. They're having a harder time keeping track of the conversation, of the instructions for the experiment. And they're not processing the complex sentences the way the typical child is. So there's a communication breakdown. That's a pragmatic difficulty, but it's not due to a social issue. It's more due to, I'm having difficulty with the vocabulary, the morphology, and the syntax here. Does that make sense, that distinction?
Oh, yes, it does. We have a question already, if you don't mind.
Sure.
Sarah's asking, politeness and manners are also super culturally based. So how do you tease apart a cultural difference versus a result of a disordered language?
I would never diagnose a child with DLD just based on a politeness exchange, for starters. The other thing is that for all children, we really have to look at their cultural and linguistic context that they're coming from. And that has to be taken into account and part of that big picture. I know I have friends from Asia who say, like, Americans are so politeness obsessed. Everything's "thank you, you're welcome, and please," so we do have to take those things into account. It's never going to be one piece of information. It really needs to be the result of a comprehensive language evaluation that involves looking at semantics, phonology, morphology, syntax, pragmatics, cultural background, parent interview, a language sample, other criterion reference types of assessment pieces, because all of those pieces have to come together. Does that answer the question?
Oh, absolutely.
Yeah.
Thank
Okay,
you.
great.
Yeah, no, thank you.
Great question, though, because that is really important. We really do have to be very cautious about that. We also have to be very cautious when we look at things like grammatical morphology, because grammatical morphology is typically challenged in preschool and early school aged children with DLD. But not all dialects of English use grammatical morphology in obligatory, it's not obligatory in all contexts. So for example, Southern White English, African American English, they use different levels of grammatical morphology, and we have to compare that to their cultural linguistic group, not to white middle class Midwestern English speakers. So that every aspect of this has to be looked at through that cultural and linguistic lens.
Absolutely. Just a quick little joke thing. When I first moved, I was in Texas for 25 years, and my very first, I was a kindergarten teacher. I'm going to say this really fast. One of my little students said, Mrs. Hernandez, I was married to, Mrs. Hernandez, I need to go use her that quick. I did not know what he needed. I was like, what do you need? What do you need? That he was trying to tell me I need to use the restroom very quickly. Anyway, so it just is like, dialect does matter.
Absolutely.
He did get to use the restroom very quickly. Yes, don't worry. Anyway, but thank you for pointing that out, that also that, we do need the cultural and linguistic responsiveness and sensitivity goes along with everything that we do. So thank you for pointing that out as well.
Well, and the other thing that we often think about when we think about cultural linguistic differences, we think of the other dialect as being more simple than our dialect, somehow that our dialect is always more sophisticated. And that's also not true. For example, many kids with who speak African American English, they make the distinction between I had waited for a long time and I have waited for a long time much more easily than users of mainstream American English, because they make those types of distinctions within their language much more frequently than we do. And, another example is in some places, I think of when I lived in Missouri, the Southern Missouri, people would say, if you go to the store, you could pick up some milk. Well, that's stacking modals, that actually makes something more complex, and it's also more indirect and it's more polite. So that's a kind of more complex use. So we have to be careful that we're not always looking at dialect differences as something that somebody else doesn't do that we do.
Right. That would be in implicit, what is that?
Implicit bias.
Implicit bias. Yes. Yeah. And no, we aren't doing that.
Yeah.
No.
I'm going to throw out some stats on why early identification is critical.
Yes.
So both academic risks and social emotional impacts. So from a Young et al. 2002, children with DLD face significantly higher risk compared to their peers, which are 6 times more likely to have reading disabilities, 6 times more likely to have significant spelling problems, 4 times more likely to struggle with math, 12 times more likely to face all 3 difficulties combined. So the sooner we can get them, the more support we can get them for their academics later. But also social emotional impacts, we have 6 times more likely to experience clinical levels of anxiety.
Oh.
I know, and anxiety is going up. It's probably from unidentified language disorders. 3 times more likely to have clinical depression. Twice as likely to go over a year without employment as adults.
Oh.
That's significant. It does not go away. And just to bring home that DLD can be a lifelong disorder. Presenting those DLD starting schools, it's going to manifest as adults. And those are Tomlin et al. From 2003 is providing those stats.
And really importantly, one of the things that we have to be aware of as SLPs is that we are critical in the identification. And when people say things like, oh, they'll catch up, I'm not saying we throw everybody in therapy, at the first sign of a concern, but we have to realize that when a child is disfluent, we hear it. When a child glides their R's, we hear it. When they stop their consonants or front their velars, we hear those things. But language is more hidden. And we really have to have a solid foundation in our understanding of language explicitly. Like, I know what that is. That's something I can address in order to help identify DLD in kids.
And I really like that hidden impairment.
Yeah, and it's the most common developmental disorder that you've never heard of, is what I say when I talk to people who are not SLPs. And there's a very good article that I would consider it to be one of the most important articles of the last 10 years in our field in pediatric SLP, by Carla McGregor, that I would recommend that people read. And it's a little brutal. The title's a little brutal. It's How We Fail Children with Developmental Language Disorder. And it really talks about how it's hidden, how there's a lack of research, how there's a lack of communication about what is this DLD thing, because we all have these different terms.
Yeah.
That
And
we
McGregor, that is a 2020 article, so it's more recent. So it's a great one to start with if you haven't read it. But she gives 4 main reasons, and the number one is it's an unknown disorder. We know what aphasia is. We know what apraxia of speech even is more common, I think, than DLD. So there's just not using that specific terms across settings. People are confused within the school settings, lack of awareness. That's the number one, is just that unknown disorder. And then she lists 2 as, just like Dr. Ogiela was saying, the hidden impairment, because it is 2.4 times more likely to be unidentified than children with speech disorders. And you can't hear it. And you just think they're going to grow out of it. And that's just not going to happen.
It's kind of like you have to be listening for it if you're going to hear it. And it's hard for a teacher to say, oh, well, I noticed that they're dropping all of their articles and copula and auxiliary verbs. It's not something that they'll notice, but they do notice that the child sounds like a younger child, doesn't sound like their peers. And then we're challenged with older kids. They do get those eventually, and then they sound like their peers in conversation, but not when it comes to academics.
And I'm going to go back to McGregor, because the 3rd and 4th main reason is, we'll talk about it more, is outdated policies. Insurance often denies coverage or wrongly views it as a delay or educational problem. And whereas autism has mandated coverage in 46 states, DLD does not. So I think that's really interesting. And then back to the cultural constraints in diagnosis. Most diagnoses happen only in the school setting, not in the clinical setting. SLPs may be discouraged from using diagnostic labels, which we'll talk about. And then parents receiving vague or confusing information. I mean, how many people have you ever talked to that says, yeah, my child has a developmental language disorder? Says no one.
Yeah. No, right. We don't hear that. Okay, I think I've got the right, this one is the one for, I just sent it back in. Here's the link I just did for the McGregor. So hopefully that one works. Would someone click on that and see if that will take you there? I hope that is it, because that is a great one. And what was the other one, the Tomlin? The one that had all the stats, because we had somebody asking for the stats, if I could get the...
Yeah, Young et al., 2002.
Oh, Young et al., okay.
Can you spell Young, Wendy? Is it J-U-N-G or is it the Y-O-U-N-G?
Y-O-U-N-G.
Okay, let me see if I can grab that. Oh, good. The link I just sent works for them, for the McGregor one. Great.
So can I ask, Sarah asked a really good question, and I'd like to provide a response to that.
Yeah, I was about to just ask you that question. So yeah, you take it. So those that are going to be just listening, Sarah asked if she could talk a little bit more about how a child can sound like their peers in conversation, but it doesn't translate into academics.
Okay, so you have a child, you can have a child that even was getting services in the schools potentially, and because they dropped their EDs and their S's and they didn't have a good vocabulary, and then they're in third grade and they score a 78 on the self, and so we boot them out of therapy. Um, and now they're in fourth grade, and this is that key time when we move from learning language to using language to learn. And we're not learning to read anymore, we're reading to learn. And children with DLD will typically have very vulnerable syntactic systems and linguistic organizational systems. And so the child now uses all those little morphemes, those suffixes, most of the time, misses it sometimes, but most of the time they're using it. They're having conversations. So what did you do this weekend? I had a soccer game. Simple sentences. Sentence. I had a soccer game. Oh, how did it go? We won. Simple sentence. It was awesome. What'd you do afterwards? My grandma came. She took me out for pizza. So this is child, they're using language. It's not that they're not using language. It's not that they're not using full sentences. But but if you put that child in, explain to me the three branches of government,
Oh,
that child is going to be very challenged to not only comprehend complex sentences that are often used for academics and for teaching, but they're also going to be challenged in producing those types of sentences. And they're more likely then in the academic setting to say something like, there are 9 planets. They around the sun. They're in space, right? They're not using the vocabulary of orbit, revolution. There's a solar system. They're not using the language the way that our academic, not just our academic texts, but our spoken academics use the language. So that's an example of where it really becomes hidden then, because the child now looks like they can have conversations, and they can. And at a conversational level, they're doing fine, but they're struggling when we go to higher level vocabulary and higher level syntax.
And they know it. They know that they're not as smart as their peers. They're not getting it. They're not doing well on the test, even though they studied twice as hard as their peers.
And they're
Or
not
they could tell
volunteering.
everything to their mother that the night before, but then weren't able to do a written multiple choice test in the amount of time that everybody else could.
okay. Thank you. That really does explain it. And I love how clear that is. And thanks for that question, Sarah. So,
I have to work on my solar system example. I know I didn't do a good description there, but
no, I was right with you. I was right with you on that. So, I mean, I think we're starting to get a better understanding of DLD. I'll be honest with you. This is I'm going to jump in and just say, y'all, don't worry. This is not going to be a one episode. We're actually breaking this into 2. So y'all don't, because like me, I'm like, okay, I'm still not there yet. Because I have a lot to learn on this. So I just want our listeners to know this is just part 1. I think I forgot to mention that at the beginning of the episode, that this is part 1. We are going to have a part 2. So here we go. But I think we're getting a foundation of what it is, right? But how does that fit into our system of school and eligibilities and like what is the difference between DLD and special education eligibilities? Because how does DLD fit into when we're putting an eligibility of speech language impairment? Because I like the way you explained that speech language impairment, SLI, is not a diagnosis. It's the bucket. I loved that visual, that it's everything in there. So that's not the specific diagnosis. So let's get into that. Let's unpack that.
Well, we're going to start by talking about the alphabet soup problem.
Okay.
Okay.
Yeah.
So when I learned about SLI,
Mm-hmm.
it was specific language impairment. That's what I learned in my master's program. It's basically what we call DLD now. It was a term that I didn't know until I started working in the schools that nobody in the schools actually used. Or very few people in the schools actually used. And it was used kind of in the university clinic, it was used in research, but it didn't make its way into the school because the same term SLI meant speech and or language impairment in the schools. So SLI meant two different things. And now I'm in my program at Idaho State, and SLI means sign language interpreting. So it's the alphabet soup problem with that piece. So specific language impairment was the term that research was using. So when you are looking at for information on DLD, also look under specific language impairment because there's a good 25 years worth of research, and we don't want to reinvent the wheel. But under the term SLI. Now, in the schools, we have SLI, which is speech and or language impaired. And so that is the bucket. I just came up with that actually.
I love it.
But I love it. I'm going to use it from now
I love it. Keep it. Yeah.
And so in that area, we would say a child with articulation disorder would be eligible for services under speech or language impaired.
Mm-hmm.
A child with fluency disorder or person who stutters would be considered under speech and or language impairment. DLD would be one other category that fits under speech and or language impairment. So one of the things that we really have to keep in mind, like before, most of the time we would just say, oh, they're language impaired. So they're speech impaired and language impaired.
Mm-hmm.
But what exactly that means, we didn't have kind of a cohesive view of what that meant. But the other reason it's really important is that the younger children tend to be identified as eligible for services under speech and or language impairment. But many of these kids start out as under speech because that's the more obvious. And so one of the things that, Carolyn kind of found Wendy and I through an ASHA presentation where we looked at a case study that Wendy kind of said, hey, Diane, what do you think about this? And and I'm going to let Wendy talk about it a little bit because it started as an artic issue and it became so much more over the child's evolution over the course of, I think it was 2 years, right, Wendy? So
Yeah.
talk about this little guy.
Yeah, so we got this little guy, and he'd been already in speech therapy, getting phonological speech sound disorder diagnosis, and that was obvious. And so he was treated, again, English speaker, no concerns for medical or other diagnosis, hearing was ruled out, no autism. And as a matter of fact, he was extremely expressive. He talked all the time. He would love to tell you stories about what happened on the playground. You just couldn't understand them. Okay, so we see him. By this time, he's 5. We're understanding most of what he's saying. Definitely start picking up on the syntax, the pronouns, the plurals. Definitely has those issues. But there's something about him that's just not right. And that's kind of when we called in to do some more language testing and got Dr. Ogiela involved, because not only was speech difficult, he was making progress, but it took longer for him to get that phonological awareness. He wasn't hearing himself. He wasn't correcting himself. He was that kid that walked out of your room and started talking again like you weren't even there. That half hour hadn't even happened. But we're also seeing a lot of literacy issues. Like he's just really not picking up on identifying letters and sounds, and we're like, what's going on? So we did more testing, and the testing really showed us where that developmental language delay came in. He did have, within normal limits, receptive language. So for his age at 5'6", he was doing fine. He did fine with pragmatics. And we did the nonverbal cognitive test, the Tony 4 on him, and that was a real strength as well. So the pieces that were really missing, we had to ferret out using the self and the tills. And so that phonemic awareness, vocabulary awareness, the non-word subtests, the listening comprehension, those were those subtests that really got to him, that to qualify him, whereas the owls really didn't. And so from doing this, talking with Dr. Ogiela, and I was not a specialist in this, and so you have to be okay with that and just reach out to people that know more than you do, or say, and hopefully people that are listening have a safe place to talk to and say, hey, hopefully this is a safe place, and you can get better at the assessment to identify these kids earlier, and because that's what we had to do, because the testing on the owls did not qualify him for a language disorder in the schools, but our testing with the TILs and the CEL5 did.
Yeah, so one of the things about assessment that you have to be really careful about with kids with DLD, because a lot of times it breaks my heart when the kid's at a 78. I know he's got all these problems, but the score is a 78, and they have to, in Idaho, it's got to be a 77, right? But the test matters because there's no such thing as a comprehensive language test that really tests everything. And receptive language and expressive language are not opposites of each other. They seem like they are, but we have a receptive language task of following directions. We don't have an expressive task of giving directions, right? So they're not equal. They're not opposite and equal. They're different tasks. And so even if receptive language looks typical, did you really look at complex sentence comprehension, or did we not? We may or may not have. It depends on the test. So we really have to find those tests that evaluate the area where the child seems to be having difficulty. So that's something we have to be kind of cautious about when we're doing that. And with kids in the schools, the SLI often gets used when the language impairment is identified at a younger age. Mm-hmm. When it's not identified at a younger age, which it is under-identified, the child then can't read, and we want to keep in mind that there's about a 50% overlap between kids diagnosed with DLD who also have dyslexia, and kids who have dyslexia, 50% of them that's where the research is showing us that about 50% also have DLD. So they're not one and the same, but they are certainly very related. And this little guy that Wendy told us about also eventually was diagnosed with dyslexia as well.
Yeah.
And so that clusters in the schools. So there are children who will be identified as SLD with dyslexia, specific learning disability.
That's where I was about to ask some questions. Okay,
I'm sorry. Go ahead.
No, because I was thinking okay, when you were, Wendy, when you were talking about the stats and you were saying 6 times greater to have reading disability, issues with spelling, issues with math, I started thinking of SLD, specific learning disability. And then I was wondering if there is and then now you just said the 50%, not causation, but a correlation between dyslexia and DLD. It started making me think that these kids, it's affecting them academically. Talk more about the connection with DLD and SLD, and then I need more.
Okay.
Yeah, I'm floundering just a little bit right now.
So SLD is specific learning disability, and that could be in various areas. So
That's a bucket too.
it is a bucket. It is a bucket. But if you look at the definition of SLD, it's a language disorder. It's literally in the definition that
Of
it's
specific learning disability.
is difficulty with language.
I'm sorry, mic drop.
Now, even for now, there are other children who will have dyscalculia, which is also a learning disability, which is primarily quantitative. But math doesn't happen in a vacuum. It happens in applied contexts. So we have these kids who do really well with arithmetic. Like in the olden days, we didn't do word problems until we got to fourth grade. Now we're doing word problems earlier, but they're okay with arithmetic. But then when it comes to apply this, it's a word problem. I even had my son's math teacher, I was asking about kind of the shift to Common Core and how she felt about that. And she said, well, it's true. And I love that we're looking at applied math. And she said, my struggle is I know how to teach math, but now we're teaching things within word problems earlier, and I don't know how to teach language. And I have these kids who are struggling with the language. And I was like, oh my gosh, the math teacher recognized it. That's kind of amazing. I didn't think of it that way. And I'm an SLP. So many of the specific language, specific learning disability, it's the alphabet soup problem.
I know.
Are language-based, and reading difficulties, specifically dyslexia, is a big part of that. Dyslexia is, its core is in the phonological system and the linking of sounds to letters, sounds to words, and that correspondence, and then being able to process all that in real time. And children with dyslexia over time, if reading is a chore, they read less, vocabulary reduces. They read less, syntax doesn't get developed as much. So it's kind of a circular thing. It works the other way around too, though. If you have a child who was not identified with a DLD, they have a reading problem, which all kids with DLD will have a reading problem. The reason is that what do we read? We read language. What do we write? We write language. The problem is with language, not with speech, although it can be. It's not with writing, but they can have difficulty with writing. It's not visual, it's with language. So a spoken language disorder results in a written language disorder, although not all written language disorders go backwards in the same direction. So a child may have dyslexia and not have difficulties with spoken language. That's a distinction. But so we have some kids who may have DLD, but were never identified with DLD. Then they're identified with either dyslexia or reading comprehension difficulties, reading and writing problems. And they're being seen they're getting services for the learning disability, but sometimes the SLP is never involved. And we have a different approach to language and understanding and how we deal with that language. So the SLP really needs to be part of that. They don't have to be in charge of it. They don't have to, if the child's getting the services that they need, we can be not involved. But if the child's not getting the language piece of the reading, then we perhaps should be involved in that.
So Taylor's asking a question, but I want to affirm, Taylor, this was my next question. So she said it was quite silly. No, it is not quite silly at all. I want to know this too, about how SLPs can't diagnose. I think people hear this all the time. Some SLPs are told not to put the word disorder in the report because an IEP, the school team, doesn't technically diagnose. I want to talk about that because I think that is something that we need to clear up.
Yes.
So everyone, scoot your chairs up.
Okay.
Here we go.
So pardon my soapbox.
No, you step up, Ladybug.
So
Everybody
here's the
listen.
thing.
Yeah.
We are all trained as speech language pathologists. We are clinicians. We do not stop being clinicians when we walk into the school. We are not, and I do not allow myself, nor do I allow my students. I know that they back off, but I don't allow them to be called speech teachers.
No.
We don't teach poetry. We don't teach debate. We are not speech teachers. We can be speech and language teachers if we need to be, and that's okay. But we have a different training. We are not classroom teachers.
No.
And if they'd let us into the classroom, that'd be awesome. But at the same time, our focus is different. And we don't stop being the clinicians. I have a problem with being told we can't diagnose. Nowhere does it say that. I have looked, I have tried to find it. Now, we also have to keep in mind that some of the eligibility, there are 13 eligibility categories in IDEA 2004, and some of those are diagnoses. Autism, you can have an educational diagnosis of autism.
Sing it, sister.
And I hear people say, well, we don't want to call it a developmental language disorder or a specific language impairment. Okay, nobody has a problem saying the child has an articulation disorder.
Diagnose that.
Nobody has a problem saying the child has a hearing impairment.
Vision impairment.
Or vision impairment.
Yeah.
Those are diagnoses. Now, I'm not diagnosing autism on my own because
Right.
I am not going to give a medical diagnosis, but developmental language disorder, articulation disorder, childhood apraxia of speech, those are voice disorder, those are all communication disorders. And yes, my scope of practice, if you look at ASHA's scope of practice for SLPs, it is the diagnosis and treatment of communication disorders. Now, if somebody's going to get all upset about that, you don't even have to call it a diagnosis. I have a hard time not putting disorder in there. I really don't know how to approach that. You can call them developmental language challenges, and then tell the parents that they can find information through the DLD and Me website. Because if you don't give a diagnosis, parents don't know what you're talking about, and they don't know that it has real impact. I don't have the citation. I'll try to have it next time. But there was a really interesting study that asked parents about their child, and they were frustrated. They're like, my child is in 5th grade. They can't read. They can't follow along in class. You told me it was a language delay. You never gave me a diagnosis. And that study showed that one of the most important things you can give a parent is something that they can, a thing that they can go find information and connect with people and connect with resources. So I'm sorry, I digress there a little bit, but I think it's really important to recognize that. So what I tell my students as we talk about eligibility is I will say, where is the child's eligibility? So I can say, Morgan is eligible for speech language therapy services under the category of speech and language impairment, or under specific language learning disability, which does have to involve the school psych in most states, due to a moderate developmental language disorder characterized by, and I'm going to list difficulties with vocabulary, difficulties with complex sentences, difficulty applying these things in discourse like storytelling, narratives, explanations, academic texts, that type of thing. So I'm describing it. And I don't have to say the child presents with a diagnosis. I'll leave that word out because I don't really care if the word is there or not, as long as the concept is there and that the teacher can look something up and say, oh, what is this DLD thing? I found this article about how to support my students with DLD, because that's what it is. And
I like it because words matter. So what I'm hearing is that we
do.
would say the student has been found eligible for special ed services under the under specific, under speech and language impairment, what did you say? Because it was so good. In the
Characterized by.
in the area of developmental language disorder, characterized by, and then their specific weaknesses, because I think it's important. And I heard at the very beginning you said that, oh, that sounded really aggressive. I didn't mean it like that, like you said. But it hit right with me how when a child is school, like language delay is for our early learners, our babies, our early childhood, our little kiddos, where there may be a delay. But if the delay extends to school age, this is not just a delay any longer.
Right. Now, one of the things I see some of the comments saying, but there's really this push away from diagnostic labels, and I understand that there is. And if we had this conversation 20 years ago, I would have had a different opinion than I have now. You know, the pendulum swings in our profession.
Sure.
We went from not wanting to label things to needing those labels to get the types of services that our children needed. And now sometimes we're shifting away because we want to accept people as who they are and not kind of and not have them kind of pigeonholed in an area. But at the same time, we need access to those services. So if I were in a school district that said you can't say disorder, then I would say developmental language challenges that impact their social and academic progress. You know, social development and academic progress. If we need to change that word, I don't love it because I kind of think we're sometimes kind of hiding behind words. But at the same time, what really matters to me is that the child gets the services they need. And if I need to say to the parent, here's a website, I can say, here's DLD and me. Check out this website. It can have some really helpful information for you. And I don't have to say the word disorder if that's really the issue. Because I do know.
Oh, sorry. I was saying, I don't think the problem is I've always, for most of my career, later it's been the whole gamut, but my early career was early childhood and elementary. And we kind of candy coated it. So it was more palatable for the parent to hear. But I'm not sure if that's really doing the family. I feel like it's kind of doing a disservice that we kind of oh, it's not that big of a deal. But if it wasn't that big of a deal, they wouldn't need our services. You know, I mean, part of the 3 prongs of getting school-based SLP services is that it is required. Not only is it required, it is also only can be provided by a speech language pathologist. Thank you, V, for agreeing with me. Yes.
Yes, absolutely. And I do understand that we have these kind of fights, but this is also one of the things that parents were saying in this study was like, I need to know what it is. And I understand that somebody might say articulation issues for CAS, but an articulation disorder is not the same as CAS. And the issue there is you treat it very differently. You treat a true childhood apraxia of speech. It does get sometimes overused, but a true childhood apraxia of speech gets treated differently. And that's a child who's going to have severely limited intelligibility, may need some AAC, may need some core vocabulary, and saying that it's an articulation issue doesn't tell you what the issue is that you're trying to remediate.
And I'm wondering if the people in the districts, and I'm just going to be sassy. Sorry, sassy Carolyn's coming out. Are they SLPs that are coming down with this terminology, asking us to, you know, and I would gander that they.
Yeah, I would really want to know, like, if they're being told not to use those, like, ask them why. Yeah, I love what Marcy just said. OTs and PTs, they're diagnosing things all the time. It's like, really? I mean, of course we have the same ability to do
I know what the fight would be on that one. They would say that OTs and PTs must have medical clearance in order for them to get school-based services. But I am going to say they are not pathologists, and we are, and that is a big difference. And I think that we should stand up on that soapbox all together, holding hands, saying that we are speech and language pathologists, and that is what we do. We diagnose and treat communication disorders.
And actually, the history of that is really interesting because OTs and PTs previously could not diagnose, and they had to work under the orders of a physician. And the reason that we are not called, that we have the weird word of pathology, which when I worked in the hospital, sometimes I would get sent samples of tissues, is that ASHA, or whatever ASHA was at that time, chose that term because it did not have therapist in it, because it is that we are independent. For I can't diagnose a stroke, but I can diagnose aphasia. So because it's a communication disorder. So, but we do have the practicality of, it's me, I'm a new SLP, I've been out for 3 years, or I'm an old SLP, but I've been around and it's just me in the school, and I can't always have that fight. I need to be able to put terms into a way that serves the child's needs. And
I'm just gonna put a plug in for that DLD and Me website. They have some beautiful infographics that you can really help, and print one out and throw it up on your door, and maybe somebody will read it.
I'm going to see if I can get that and put it in the chat.
DLD and Me.
Oh, I got it.
Yeah,
I think I got it.
And what's really nice about that site is you hear from kids who actually have DLD, and you hear from parents.
There's some videos that are really nice.
There you go. dldandme.org. Yeah, I mean, I think words matter, and I think that we need to be, sensitive to our families, but we also we have to be real about what's going on. I mean, we can say it in a nice way, but we need to say what it is. So it's not just a delay. It's, oh, don't worry about it. It's just a little delay. We're just going to tweak a few things. No, this could be, and I think you're right when you're saying that parents want to know, so they have an understanding of why it's affecting all these other areas. It's not just, oh, they just need speech. Listen, ladies and gentlemen, think about this. This really opens that door of like, speech isn't the end all be all. Just a little speech is going to help them everywhere. I think we need, this is just, okay.
And can I just say one last thing?
You can say all sorts of things, yes.
That the most important piece here is to have an understanding how much language plays a role, not only in social interactions, but in academic, in schools, in academic progress, but that also translates into vocational skills and abilities. And kids with DLD, among a lot of the kids with various special education needs, they have a great deal of potential that with support, they can learn to read, they can learn to communicate, they can learn to read complex things, and their independence sometimes depends on having had that support. So it's not just language. When I hear like, oh, it's just language.
Right.
Language is the crux of academic education, and it's the crux of being able to have a job and be independent. It has economic implications, and so it's really important.
Because I heard that earlier, Wendy, you mentioned that students that have DLD are, I can't remember what the exact number was, about being out of the job market for a year.
Yeah.
Yeah, that was like, I mean, talk about all of us secondary, because I also went secondary, talking about transition and our whole thing is to get them a job, right? Yeah.
Twice as likely to go over a year without employment as
that's
adults.
What it was. Twice as likely. Wow. I mean, okay. I know that we are coming towards the end. And so y'all, we are just getting started. And so we are going to have a part 2. Diane, Wendy, do you want to give us a little teaser? Because where are we going next?
I'm hoping we're going to go into some treatment, because you can do all this assessment, and if you don't know what to do with it, what difference does it make? So we really want to talk about some of the strategies and how it's different from kids that are 4 and 5 and 6 to someone that's 16 years old, because sometimes there's a big gap in that. So I'm hoping that we get to kind of cover both.
So
Yeah,
looking at the characteristics across the age span, I'd love to hear more also about doing a better job at assessment. So maybe part 2, we can do assessment and then the treatment, which is going to be different for different.
Yeah, I think we're going to frame it. We're framing it as how the characteristics and the needs change over time. And so when we talk about the characteristics, we're talking about assessment. When we talk about the needs, we're talking about the intervention and how the focus of intervention needs to change over time to continue to support these kids. Because we do need to move from teaching them bits of language to teaching them strategies on how to deal with language when it's challenging. And there's a continuum there.
And that's what Taylor just asked. So Taylor, you better come back. I'm gonna look for you, Taylor. David. Ooh, that sounded. I sound so aggressive sometimes. I'm just being sweet, Taylor. But I'd like to see you come to part 2. But I really, you know what? This has been such an important conversation. Wendy and Diane, thank you so much. And thank you so much for agreeing to do a 2-parter. I knew that when we were talking originally that this was, part 2 will be the next episode, which will be in a couple weeks. I have a little bit of a break, but I think it's May 6th, that Wednesday. So yeah, so May 6th. Man, I have learned so much today. To all of our listeners, thank you so much for being so interactive today and really being there and being present. If this episode helped, tell your team about it. Tell your friends. Always, thanks everybody. I want everyone to keep showing up, keep asking questions. I love this so much. Keep doing the work that we're doing that really is wonderful. Thanks for being here, everybody. I don't want to say goodbye. I really don't.
Well, thank you for inviting us, because it's been a really great opportunity to hear that these things are resonating across SLPs in the schools, that these are the challenges we share.
Absolutely. And don't forget, you live listeners, make sure that you get your credit for listening today. Go to SpeechTherapyPD account and fill out all those modules. All right, you guys, until next time.